everyone. Welcome to our August 2022 version of Ask the Expert interview series. I'm happy to have Jeff Mortenson with us today. He is the Executive Vice President of Rebion, and some of you may know him from prior experience working with him with some spot cameras several years ago. But we are happy to have Jeff with us today to talk a little bit about August being Children's Eye Health and Wellness Month, and with his background and experience, just wanted to ask him some questions. So Jeff, I'll let you introduce yourself a little bit and tell us a little bit about Rebion and then your background as well.
Sure. As you mentioned, some of the viewers will recognize me from the past with the spot devices. My background goes about 15 years ago when PediaVision was started, and we began working with the Kentucky Lions very early on in that, back around 2009, and that led to the successful rollout of the spot devices in Kentucky. And it's been a pleasure to see that organization grow over the years, and it's great to engage again with the Kentucky Lions. As many of you know, with the spot camera coming into play around 2011, shortly thereafter, the American Academy of Pediatrics put out a policy statement supporting the use of vision screening instruments for early childhood screening up through age 6. And we feel very fortunate that we were able to be part of those stakeholder meetings prior to that, and building confidence with the organization that the companies that developed these technologies were here to stay. While I was at PediaVision, I had met, in fact, in 2011 with the Rebion founders, and was able to see their development of their technology. And in fact, we had times of talking about a joint venture of mixing the technologies to have an even better device. That never came to fruition. However, Rebion continued. They got FDA clearance in 2016. And at that time, I was fortunate to be invited to join their team because I really saw a technology that was moving forward in the industry, where a lot of the technologies have been kind of the same rehashing of technologies from back in 2000 and 2001. My initial role at Rebion was to help commercialize the Blinq vision scanner. And once we got that to market, my role expanded to managing all the customer-facing efforts, marketing, sales, clinical studies, and most notably now is getting customer feedback on usage and how we can improve the device going forward.
Perfect. As I mentioned earlier, August is Children's Eye Health and Safety Month. And we know, based on our experience and yours as well, that the best way to save a child's eyesight is through early detection of these vision-threatening conditions. So can you kind of explain more to us why this early detection is such a key difference maker?
Well, with children, they develop starting at a young age, and as they go to school, they continue to learn, and vision is so important to their ability to learn. There's issues out there or stories out there about how vision and the high percentage of their learning has to do with vision. So being able to detect vision issues as they occur and treat them immediately is key to make sure they don't fall behind.
And so what ages are we saying when we say detect early? Kind of, I know it probably varies on the child and what's going on, but kind of what age range are we looking at?
I think we look at two buckets of age groups. One would be the early childhood and preschool age group, and the other would be the school age group all the way up through high school. When you look at the younger children, you're looking for diseases that could lead to permanent vision loss and leaving them impaired for the rest of their life if not treated within a timely fashion. Whereas in school, you're looking for more structural issues like nearsighted and farsightedness to make sure they can read books and see the chalkboard. And those diseases tend to come in through adolescence.
So going with the younger children, these diseases that, if not caught early, could lead to potential vision loss kind of what are the most common vision threatening conditions in the young children?
Yeah, the most common are amblyopia and strabismus, and those affect 1 in 20 children. It's the number one cause of permanent monocular vision loss in the US. And it's not only for children, but children grow up to be adults. And if they're not treated, they're adults with amblyopia and strabismus. A good example what that is just to simply put your hand over one eye. And that is what these people are living with amblyopia the rest of their life. And you can also understand how delicate vision is, when you look at the elderly getting glaucoma, macular degeneration. If you get that in that one leftover eye, they lose sight at ages younger than they should. So catching amblyopia and treating it before a child enters school is very important.
So at Rebion, you've partnered with others to develop the technology that you mentioned earlier, the Blinq pediatric vision screener, and it helps detect these two issues that you just mentioned. Is that correct?
That's correct. Yeah, our scanner was co-developed by pediatric ophthalmologists at Johns Hopkins and Harvard. These ophthalmologists were often seeing children show up at 8, 9, 10 years old with amblyopia or strabismus, and it was too late to do any treatment, and it was very frustrating for them. So they set out a goal to create a technology or a method for identifying children young, so they have a better success rate for treatment. So if you get a child in the 2 to 6 age group and begin treating them, there's a 95% success rate on treating for amblyopia. But as I mentioned, once they reach 8, 9, 10 years old, it's too late, and that 95% chance drops down to 0 quite rapidly, and leaves them permanently blind in one eye.
And then who is using the Blinq, or how is it being utilized right now to detect these two vision issues?
Right. So Blinq's the first and only device that's FDA cleared to detect amblyopia and strabismus. So this is a relatively new technology. It's been out for a few years. It's used by pediatricians in their practice on annual well visits for children 2 through 8. There's also several public screening organizations, such as your Lions Club and other Lions Clubs around the country, as well as Head Start programs that are government sponsored. And in many states, Department of Health or Department of Education support the vision screening, and the device is being used in those locations as well.
It's only been out a few years, but what is the current accuracy rate of the Blinq?
Yeah, so the device has been well studied going back to 2014, which was led to FDA clearance. But since then, in our current product release, we've got 2 studies that were published last September. Both show 100% sensitivity for identifying amblyopia, strabismus, or other ocular vision deficiencies. So if the child is referral warranted, as we call them, we're 100% capable of picking those up. We do have some false positives. Any type of clinical tool out there, and we see it now with COVID test. Everybody's asking what's the sensitivity, specificity, how many false positives and false negatives. We're very fortunate that our false positives are very low and industry leading at this point. So we're really pleased that we're not over referring too many. The over referrals has been a problem in vision screening, especially when you talk about manual screening or some of the early technologies where they weren't quite as efficient. They would clog the pediatric ophthalmologist practice with over referrals. It frustrates parents to take a day off work and paying to park at a facility in a downtown of a big city. So we're happy to reduce that. And so people that are referred with our device certainly need to go and should feel comfortable with that.
Perfect. That's great. Can you just kind of walk us through a little bit how the actual device works?
Sure. It's a handheld device. It's shaped about the size of a soccer ball. I have one here. It fits in the hands, both hands. And by simply pointing the device at the child from 14 inches away, which is optimal to detect accommodative esotrope, or those children that have the eye turns in. That's the key, but it does pick up all amblyopia. They just look inside here at a smiley face for just 2 seconds, and we get a quick capture. And then the results will present on the touch screen immediately. So what happens when the device is doing the test, it measures a fingerprint on the back of the retina where fixation starts. So what we're trying to do is make sure that a child has sound binocular vision, that both eyes work simultaneously to focus on that target. If there's any deficiencies, it will yield a refer and show that both eyes are not working in unison, that the brain and the eye connection are not working together. So if it's a refer, you certainly need to go. If it's a pass, you can be very assured with our 100% accuracy that your child is healthy.
So you showed us the screen. You said the results come up on the screen. But what kind of information is then handed off to the parents if they are a referral, if they show signs of amblyopia or strabismus?
So there's multiple ways to deliver the information. Obviously, verbally, when you see the instant results, you're also able to print a report that has pass or refer that can be handed to parents. In primary care pediatrics, they use electronic health records, and oftentimes they automatically make the appointment with an ophthalmologist for the parents. And really the message they're given to the parents is, this is the date of your child's specialist appointment. We also have, for a lot of these organizations that go out and do mass screenings in preschools, we've got lots of tools that are online that they connect to the device, and they can manage the data. I think what's popular is to go screen a preschool, then to provide them a cover sheet of all the students and who was a pass, who was a refer, then individual refer results that they can pass on to the parents to schedule appointments.
Yeah, that's organizations like ours. We go out into health fairs and other events, daycares and preschools to screen children. And we will soon have a Blinq device, and we're looking forward to adding it to our repertoire of equipment and getting to use it and help detect these issues further in Kentucky. So if someone is watching today that's interested in learning more about the Blinq device, is there a website that they can go to, or anyone that they should contact?
Sure. Rebion.net is our website, and you can find out all the information there about the device, and you can request more information. We respond immediately to that. We're excited that the Kentucky Lions are getting the Blinq out there and giving that a test. Your organization's been a leader in the market, and we're really looking forward to the feedback we get from your team out there using the device.
So I just want to say thank you for being on with me today, and just ask if there's anything that I have failed to mention or anything that you wanted to add.
Sure. When we talk about eye health and education, there's one tool that we've created in partnership with Boston Children's Hospital, and it's an app called the Baby See app. And that's an app that's right on your mobile device. And it's a parent education app. Starting at birth, it shows parents how children see. There's a simulator on there. So if your child's 6 months old, you can plug in 6 months, and you can point your device at, say, the Christmas tree, and you can see how they see the Christmas tree at 6 months of age, or you can point at yourself and see how they see parents. We also have a segment called IQ, which educates parents on what to look for in their children with their vision, signs that they may be struggling with vision. And it also gives you a list of what to expect when you go to your pediatrician or go to school, what type of screening, what type of eye tests are occurring. So parents can understand going in what's happening, instead of kind of wonder what's going on and hope that the doctor or the nurse has got the time to tell you what's happening. So we're excited to partner with Boston Children's Hospital to get that app out, and it's getting a lot of downloads pretty quickly, and not just in the US, but around the globe. So people are finding it a very useful tool.
Is that just something that can be downloaded in the App Store, or how do people access that?
Yeah, they can get it through where they get all their apps, either with the Apple or Google. You can also go to our website, and there's a QR code on there that you can scan and download it directly as well.
And be neat to see as a parent how that, how your child is actually seeing. So, well, thank you for sharing all this information with us today. I look forward to working with you in the future again as we get that Blinq device out throughout the state to help enhance our vision screening programs. And thank you so much for being on with us today and all of your support of our organization.
Great. Thanks so much, Jennifer. I look forward to seeing you again soon.